someone is in an accident and the paramedics come and they check his pressure or her pressure, it may be high, but that does not mean it's hypertension. That's just high blood pressure because they're, worried about the car or loved one in the car or something. Accidents are scary. So that's not high blood pressure. But the problem is the undiagnosed high blood pressure. As I just alluded to earlier, a lot of seniors don't know they have high blood pressure, and undiagnosed blood pressure will lead to, for example, dementia. Think about it. Undiagnosed high blood pressure can cause vascular dementia. That means you can eventually develop memory loss. So it's not something you say, my pressure is 150/90, no big deal, I'll just lose some weight, watch my salt, start exercising, all good things. But do those things and take the medicine, because once you get to 60s, 70s, 80s, it's been there for some time, that high blood pressure. And that's the last line. If you look at the last line, that's important. Over time, high blood pressure damages the heart and blood vessels. So it's over time. So by the time you diagnose it, it doesn't mean that's the time you have it. It's like an iceberg. It's been sitting below the surface for a long time. So it's very important that if your number is 150/90, we'll come to the definition of blood pressure with the next slide, to take it seriously and get it checked. Do the lifestyle changes, but don't postpone taking the medication if that's what your physician is recommending. All right, let's go to the next slide. So this is the definition of low blood pressure and high blood pressure. So low blood pressure, oops, keep hitting the wrong word. Low blood pressure is less than 90, the top number. Bottom has less meaning in the low blood pressure, but yeah, less than 60, but top number is the key. And this is a normal pressure, 120/80. A lot of you in this room which didn't raise their hands are probably up here, and they think they don't have high blood pressure, but they do. And this is not my definition. This is the, if you look at American Heart Association definition of type 1 high blood pressure, type 2 hypertension. So it's very fine line, 130 to 139. And I'm pretty sure all of you who didn't raise their hands probably have few of your numbers. Oopsie, sorry, it's just have they should keep the laser separate. But anyway, so this is where you need to pay attention. This is elevated pressure up to 129, and the bottom number is 80, but this is where most of us are when we get to 60s and 70s. That's why I said 9 out of 10, because this is based on this definition. So next time you get your pressure checked, make sure you're below this and below this. Below 80, below 130. If you're not, I'm not saying it's the end of the world. It's just, buy a machine, get it checked at home a couple of times a day, keep a diary, and if it's consistently high, accept it, that it is, type 1 hypertension, no big deal. Just improve your diet and talk to your physician about taking a small pill. So that way you don't get end organ damage. As I said, the time is not on your side because it's been there for a long time. So that's the point I'm trying to make. That, let me see if I have the right button. That you're not here and you think, it's normal, 140 is normal. And 140 used to be normal, believe it or not, 10 years ago. Yeah. So the definitions have changed, and you need to change with that in terms of your thinking, in terms of your strategy. So, something to ponder. So that's why I was saying that I was surprised only one lady raised her hand. Some people don't want to discuss their health condition in open, and that could be the case. But I respect that. But if you don't have it, I think you probably should look at these numbers. 130 and 80 should be your cutoff. Right. So what causes high blood pressure? We alluded to that as we get senior, that's what happens. If you're Afro-American, your risk is higher. Men has a little bit more risk than women, but not a whole lot. So, no one is immune if you're one sex or other sex. The weight definitely, we're seeing an epidemic of obesity in this country, and that's leading to all kinds of chronic conditions like high blood pressure and diabetes. So definitely, if you're on the heavy side, pay attention to the weight. As we age, the metab slows down. It's hard to lose weight. So, and the most important thing is inactivity. As we becoming a car-centric society, and especially in Florida, there is no public transport of value. You can wait for a bus for an hour, but no one wants to. So everything, even going to Publix, which could be 5 minutes away, 10 minutes away, there's no good roads to walk where you could be safe using cars. And that has made us obese and diabetic and hypertensive. And I'll show you the consequences of doing that. And if you have chronic kidney disease for some other reason, let's say polycystic kidney disease or genetic conditions where kidneys don't work well, that can raise your pressure too. And if you're diabetic, that can make the arteries hard and raise your pressure. So those are other risk factors. So that's something to consider if you have those risk factors. Get your pressure checked more often. Alright, so complication. Why we get concerned, why they call me here to talk about high blood pressure. This is the main slide. This is the reason why they call me to educate, public about high blood pressure. Why? A, it's very common, as I alluded to earlier, and B, it can do all this. So, as I said, what's high blood pressure? The high blood pressure is when you pump your blood, the pressure of the pumping blood hit the arteries. And the arteries are all over your body, from head to toe. So you can have complications of high blood pressure from head to toe. Let's start with the head. If someone has brain, most of us do, you can get, God forbid, strokes. Or you can get small aneurysms from the high blood pressure. Or, I alluded to something very interesting, is this. Dementia, vascular dementia. That means, you can get small strokes, and which can knock off your memory center because of high blood pressure. That's the root cause. You think it's Alzheimer's. It's not Alzheimer's. Alzheimer's is where there is no strokes. If you have small strokes on your MRI of the brain, it's not Alzheimer's, it's vascular dementia. And that's most likely is from undetected high blood pressure. So that's why, it's very important to, if your numbers are consistently more than 130 over 80, that's high blood pressure, hypertension, class 1. That's okay, just embrace it, take a small pill, do the lifestyle changes, and if you lose significant weight, 5-10 pounds is significant. And watching your diet, we'll talk about diet in a minute, you can get off the medication if you stay consistent with that program. But if you don't, then it will come back. So it doesn't go away, but if you are consistent with your diet and exercise. But if you're beyond class 2, that is 150 over 90 consistently, diet and exercise will help, but won't cure it. You have to take the medication for a long time then. Unless you change, you're 250 pounds, now you're 150 pounds. That's a different story. You had a bariatric surgery or something, then yes, then you can get off the medication. But most of in this room won't do that. So we need to pay attention. So we talked about head, we talked about eyes. Eyes can also cause retinal damage from hypertension. Then we come down. You can get heart attack. The heart itself is working hard. So imagine a pump and a hose. The hose are tight because that's what high blood pressure is, high tone in the arteries. So the heart goes into heart failure or can cause heart attack. So, and the aneurysms, what are aneurysms? Aneurysm is dilatation of the arteries. So if your arteries are weak from constant high blood pressure, and there are other risk factors like genetics or high cholesterol or diabetes, then they can balloon up, and that can be a serious risk if you get God forbid, a bleed in the brain from the aneurysm rupture, or bleed in your belly from aneurysm rupture, or thoracic aorta rupture, you'll die. So aneurysms are serious risk or complication of long-term high blood pressure. Vision problem, we talked about effect on the retina. Heart failure, we talked about that. Vascular dementia, we talked about that. So it's not to scare you, it is what it is. If you have chronic smoldering underlying high blood pressure and you're not addressing it, you're putting your head in your sand, unfortunately 10, 15, 20 years, 10, 2, 3 decades later, one of these complications will pop out. It is what it is. Alright, so now let's say we establish that you guys, a few of you guys have high blood pressure. No big deal. It's one of those conditions which we can take care of. There's a slew of medications to control it. There's a lot of diet and exercise and other things I'm going to discuss which will help you other than medications too. So let's pay attention to that. So you see up there, these are blueberries, right? So anything in berry family is phenomenal. It has antioxidants, anything colored in, by nature like beets, lemons, they are phenomenal. Some spices like turmeric, cinnamon, they are good. So any spice, any herb, anything with color, eat more. But don't process it. Don't go for blueberry ice cream, that's bullshit. Pardon my French. You got to have raw and unprocessed because the minerals, the vitamins, they get destroyed by the time you start freezing them. And freezing is still okay. If you the blueberries and let's say they are not in season, get the frozen one. They're still okay. But the minute you start making a pie, you destroy them by putting in heat. Yeah, you get some flavors, but that's it. If you really want to get benefits of the fruits and vegetables, you have to consume them unprocessed. Are we clear?
Yes.
Okay, pies does not count, just making a point. Alright, so let's see what else is up here. So this is a very important acronym to remember, DASH. It's a dietary approach to stop high blood pressure. Now, it's called DASH diet. If you Google it, there's phenomenal diet. If you have high blood pressure, loved one has high blood pressure, borderline high blood pressure, DASH diet will help you lower your pressures. What is DASH diet? So DASH diet is basically what I just alluded to a lot. So if you have a plate, so think about a plate. Let's say this is your circular plate, right? Let's say this is your square, rectangular plate, right? So you see the green line just above that green line is half, right? So that's a visual helps humans. We are more visual learners, so that's why bringing this up. So just imagine a line above the green line which makes a paper in half. Let's say this is your paper plate and you've gone to 4th of July party. You just went there. So now you have a buffet of options. You got lobsters, you got all kind of stuff there. Blueberry pie. Now what I want you to think is what Dr. Mahajan described to me is, and that will help you with no matter what you have. Even if you don't have it, will prevent it. So the DASH diet is overlaps with Mediterranean diet, and Mediterranean diet is the #1 diet for preventing heart attacks, strokes, dementia, even if you don't have it. Even if you don't have high blood pressure, this diet will help you. So half the plate when you are in that buffet should be fruits and vegetables. If you do that consistently, you live well. You'll lose weight, you'll get enough fiber. Fiber, folks, is the key ingredient. Anyone can tell me why? I'll tell you. So the fiber keeps you full. When you have fiber, let's say, this young lady, what's your name? Lila. So let's say Lila had a glass of orange juice, right? You like orange juice, Lila, right? You look like orange juice kind of Lila, right? Okay. You will say it's healthy, it's orange juice. What's wrong with that? I said, yes, it's healthier than, let's say, Pepsi, maybe. But when you squeeze out that orange juice, you threw away the most important part, the pulp. The pulp, the fiber. So what happened? Now, let's say I gave Lila 3 oranges to eat. No, I can only have, right? What happened after you eat 1? So, I'm full, right? You can drink 3 glasses of orange juice not even thinking if you want to, right? Easy. 3 glasses of orange juice is probably 10 oranges. And you can even eat half, maybe 1. And the magic is fiber. If you eat the Mother Nature's goodies in their original form, they are packaged well. We as humans screw them up. We squeeze it out, we make it convenient. Oh, it's tasty, I'm feeling nice with cold orange juice in hot Florida summer. But you threw away the magical part, the fiber, because it keeps you full and it helps your gut flora. You see, it's like birds. You kill all the trees, they have no place to live and they will die too. Not because they don't have food, you may have enough food for them, but they have no place to nest, right? Same thing with the flora in the gut. If you don't give enough fiber, the gut flora has no place to nest. They can't be healthy. So the fiber cannot be digested. It has to go through small bowel, which is huge. It has to go to the colon, and then it comes out in your bowel movement. So it helps you with your bowel movement. You don't need to raise hand. I'm pretty sure you guys dealt with having difficulty moving bowels once in a while. If you eat fiber, that's your friend. If you are diabetic, that's your friend, because the sugar, when she drank 1 glass of orange juice, goes like this. But if you eat an orange, the sugar goes like this. Think about it. All the sugar gets absorbed right here in your stomach and the upper intestine if you drink juices. Any juice. I'm just making orange juice a villain, but any juices. But if you eat the fruit, the fiber does not let the sugar go out easy. So the sugar goes out like this, and the pancreas, which produces insulin, say, I got you covered. But if the sugar goes up 200, 300 after you drink juice, the pancreas say, hey guy, what you doing? I don't have enough insulin, right? So that's the concept. So if you go down this list, you will see this concept. What I just taught you, the magical portion, the fiber is the key ingredient. Fruits and vegetables, we talked about that. Whole grain, same concept. Whole grain, let's say you take white flour and you eat pasta with white flour versus, let's say you eat chickpea pasta. Anyone in this room had chickpea pasta? Oh, this young lady, another one. Good, we got a healthy crowd here. So what's the difference? The difference is the fiber. The fiber does not let the sugar come out, so it's not as processed. It's processed, but it's not as processed. So the whole grains is the same thing. It have a lot of fiber. It's the Mother Nature's original packaging. Anytime you think you're eating healthy, think is the Mother Nature's original packaging. If the answer is no, then spit it out. So low-fat dairy, again, there's no fiber there, but it gets you calcium and vitamin D, and you need that for keeping your pressure down, and it provides you some potassium. And potassium is an important ingredient in keeping your pressure down, and that's what you get in plenty in fruits and vegetables like bananas and watermelons. Fish, poultry, again, it has omega-3, omega-6, so those are good for your brain and your heart. Poultry, again, lean poultry, beans. Beans are what we call superfood. Any kind of beans. Pinto beans, red kidney beans, chickpeas, they are beans by the way. Green beans, black-eyed peas, navy beans, any beans. Eat more, eat every day, you will live long. If you look at Weight Watchers, that's the #1 prescribed food, beans. The reason is why? Fiber. So that's a common theme. I'm just gave you a common theme. If you're not sure if the food is good, see if it has enough fiber. If they have enough fiber, chances are it's a good food for you. So think about that. Vegetable oils, less of the margarine and butters, please. And then limiting these kind of foods, the sodium, too much sodium, pretzel chips, that will, pizza, pasta, too much salt, too much processed beverages and sweets like pop, and juices, less of those. So that's called DASH diet. It's nothing fancy. It's Mediterranean kind of diet, simple, but can be done. You can make it flavors, add spices, add kind of ginger or whatever, parsley, whatever you like. Add more. Garlic, add more. Onions, add more. And make a chili. Put some beans and have it with brown rice. You have a full, complete meal. You got whole grains and you got beans. And you add some Spices, not salt, but spices. Salt is not a spice, by the way. So that's the next part. So you did the diet, we talked about DASH diet, we talked about Mediterranean diet, we talked about picking a lot of fruits and vegetables. This is the next leg. So getting your pressure under control is three-legged stool, which is diet. Portion control comes in that diet too. And the second leg is exercise. We'll go to the third leg in a minute. So, and you could be as simple as parking away from coming to Humana Neighborhood Center. Instead of going 10 times and looking for the closest, just go to the farthest. So it will do two things. A, you have to walk 50 steps extra to come in, and think about it. When you go back, you have to do 50 steps more. So that gives you automatic exercise, which became, you came here to listen to a good-looking Dr. Mahajan, you got that. Plus you got exercise. So incorporate that in your daily activities, because sometimes it's hard. We may have arthritis in our hips or knees or back or something, but you have that motivation to attend that blood pressure talk. So that will get you here. If you have to go and see your grandkids, you'll walk 20,000 steps to get there. Why? Because you're motivated. So the motivation is the key. So if you make that part of your daily routine, the mobility, you will see the difference. And if you're on Humana or any of the Medicare Advantage plans, they provide you silver sneakers. Use those. They get you money for using those. It's a win-win. You can join any gym and multiple gyms. You can do water aerobics here, which is low impact. You can do chair yoga here in a sport out, and then you can go to whatever your favorite gym is to do Pilates. You can do 3 workout in 3 gyms in 3 times a week, and you'll meet different people. You'll interact, and social interaction by itself help you with blood pressure. It's hard to do at home. Some people are motivated. They will exercise every day. More power to you. But if you're not, if you're like me, you need a little bit motivation, then go to the gym. That will get you motivated. You see, people doing activity which are older than you. That gets you role models. So yes, so anyone can do it, and everyone has some limitation. Walk around it. I have patients who are 90 and 100 years old. We have videos in our office with my nurse practitioner doing exercise, and they look at it. They say, "How can we do it?" I said, "Okay, let me show you something else." So I put on a chair exercise video. I said, "You can do it. Just put your legs up and down while you're waiting for me." And you put your arms like this 20 times. So anyone and everyone can do it. It's just that you got to think about what your limitation is, go around it. Use other muscles. So the weight, we talked about that, portion control will help you lower your pressure. And we don't need to think about becoming like Cindy Crawford or Brad Pitt. Most of them has plastic surgeries, by the way. But, we just need to be realistic. 5 pounds a year, 10 pounds a year will be phenomenal if you can lose those. 1 pound a month, I'll be happy. 12 pounds a year, that's beautiful. And that's the kind of weight you can keep off. You want to dance in your grandkid's wedding, you will lose 30 pounds. A minute the wedding is over, you picked out at the wedding, you'll gain 30 back. So that's not going to help you. The yo-yo does not help you. But 1 pound a week, 1 pound a month will make big difference in a year. So think of that. So this is something people don't think of as an issue with high blood pressure. Alcohol is a big factor. We drink wine, vodka, whatever our favorite drinks are, tequila, without thinking. And as we age, the liver ages too. And the liver is the factory for your processing of your alcohol. So 20 years back, you can drink 2 drinks of wine and it doesn't bother you. Now you drink 2 drinks of wine, you're like, next day, why? Because the liver can't handle it anymore. It lingers longer and it causes more toxicity and raises blood pressure. So if you're drinking 1 glass of wine a day, you say, French says that's good for you. But French walk. They walk. they walk and walk. We don't. So you gotta look at a culture in its own nuance. Every culture has their thing, and unfortunately, our culture is car centric, and that's causing us a lot of problems. So, alcohol cut back if you can. And same thing with smoking. I'm sorry, smoking is also critically important. When you smoke, think about it. Any of in this room smokes or have smoked? Have. Okay, good. Well, this is a very healthy room. So when you smoke, think about it. All that inhalation goes to your lung and like this, it goes in your blood. Like this. It's faster than me giving you nicotine through your IV. That's how fast it is when you inhale, it goes in your lung and in your blood. And all those Philip Morris scientists worked on the right hit to make you hooked. It's more difficult to quit smoking than quitting crack cocaine. Having said that, what's the physiology? What's the interaction for high blood pressure and smoking? When you smoke, the arteries tighten up. So if you consistently smoke, then you're increasing the blood pressure in the arteries. And you, God forbid, have a little bit calcium build up in your arteries of the heart or the carotid of the brain or the legs, and you keep doing this, you get heart attacks, strokes, lose your legs. So those things have direct consequences. And someone will give me always the example, oh, my Aunt Susie smoked like a chimney and she lived till 100. I can give you 20,000 examples, or you probably know 20,000 relatives who died, but Aunt Susie only stands in your head because the diction in your mind will give you excuses. It will tell you, always talk about Aunt Susie. So if you or any of your loved ones smoke, please help them. And there are good resources, because of the litigation against the Philip Morris of the world. There's a big fund of money with Quit Florida program, which will send you free patches and gums. So any of your kids smoke or your neighbors smoke, tell them about Quit Florida. And they will send you free patches, and they will send you free gums, and they will call you to help you quit smoking. It's all free in Florida. So it's not that hard if you want to do it, or if a loved one wants to do it. All right, so the third leg is medicine. So we talked about lifestyle changes, main being more mobility, better diet, more plants and fruits and vegetables, more beans, more whole grains. And the third leg is medicine. And the medicine comes in different shapes and forms. If you want to find out, I can talk more, but that's more technical. These just lower your pressure. Every medicine has the side effects. You got to be careful. If your pressures are high, you may need 2 medications. You may need 3. Our patient need 4. So everyone is different. Some people have very resistant hypertension, and we need to do more workup to make sure they don't have any tumors in their adrenals. So every high blood pressure patient is different. So you got to, and even the race and ethnicity has an effect on which medicine to pick. So it's a very technical topic, and there's a whole books on it. So, if you want, I can go over it, but if you want to skip it, we can skip it. But these are the common classes: ACE inhibitor, ACE receptor blocker, calcium channel blocker, diuretics. These are the most commonly given, and the fifth one is beta blocker, which is not on the slide, but it's also useful. So these are the common ones. You probably heard the name: lisinopril, Prenavil, losartan. All those are these common ones. Amlodipine, Norvasc, Procardia. Those are what's in there. Diabetic, hydrochlorothiazide, spironolactone, or lactone. So these are the common ones. So if you get medicine, just getting medicine is important, but also more important is to take them. And a lot of my patients don't want to tell me, and they don't want to, make me upset, and they don't take them. They just take the medicine and they say, I don't. And then, I see them a year later in the Mahajan Medical Hospital with a stroke, and I said, what happened, Jerry? I thought I can manage it with lowering weight, and now his weight is even higher because, they don't want to come to you because they don't want to be told to lose weight or drink, not smoke or not drink alcohol because they enjoy all that. And it's hard. I'm not saying any of these is easy, but, if you're taking medicine and you're getting, let's say, for example, if you're taking lisinopril, for example, 5% patient gets cough, dry cough. Hey, you have it, don't just stop it, just come and talk to me and say, hey doc, I'm getting cough. We stop it, takes a month and it gets out of your system and the cough goes away and we give you something else instead of risking a stroke. So the key is to take them, put a reminder system, it's more than once a day. If you have side effects, please don't stop, discuss with your provider and they can change the medication. So that's the key take-home point for any medications if you're getting from a provider. Ask them why. Why you getting it, get good answers. Most of the providers have EMRs, most of the pharmacists have electronic health records, and they can give you a write-up about those medications. It's good to read the side effects and be educated and be vigilant, but don't overread. Take it for the main reason why the condition is there. And yes, every medication has side effects, be vigilant. And discuss with your pharmacy and your primary care, and you can find some other medication if you're having side effects. So it's important is to be open and communicative with your providers. All right, let's review. So I'll take away this side because they've been hammered more, so I'll go in the middle now. So what did you learn? What did you learn from the talk? If let's say your husband or God forbid your neighbor has high blood pressure, what will you tell them?
You did have it.
Oh, I'm sorry. So,
no, it's all right.
Yeah, so tell me what you learned. What can you do
It's hard to get
different?
them to listen to you.
Say it again?
It's hard to get them to listen to you when you're I'm a retired nurse.
Oh, okay. So
So that made it even worse
right.
because you had a living nurse with them.
Yeah.
And
Wife and a nurse, double whammy.
Huh?
Wife and a nurse, double whammy.
Yep, exactly. Yeah.
So we'll skip you because you're nursing most of the stuff. We'll talk to your friend here next to you. What did you learn from the talk? So I understand that I was able to communicate. What is the summary?
My sister have like dementia.
Ooh,
It's the vascular
dementia, okay.
But she's got like high blood pressure.
Okay. So you can relate to what I was just talking here, yeah. So yeah, there's an example right there, the problem is that we take one pill and then, we want a refill after a year and a half. And I say, where you been, Jerry? Oh, I went to Hawaii and, and it's not just you take a pill and it will be effective. It may be effective, but get it checked. If you're on a medication, there could be side effects from the medication too. So it's not just important to take the medication, it's important to make sure you hit the goals of the blood pressure medication. As I said, some patients need more than one medication. So that's the key here. Not just take the medication and then, keep asking for refills from your doctors. But follow through, either you get a machine. And talking of the blood pressure machine, any of you guys have blood pressure machines?
Oh, yeah.
Okay, so we got a few hands. Do you have the one for the wrist or one for the arm?
Oh.
Right, the one for the wrist, give it to the neighbors you don't like.
Yeah, exactly. I agree.
So the nurse said she agrees, and the reason she agrees is the smaller the artery, the tighter the cuff, higher the pressure, and it's not your pressure. So
The cuff
always,
is more accurate.
right, always take measurement of the bigger blood vessel, which is up here. And make sure the cuff is covering 2/3 from shoulder to your elbow. It should be big enough. If you get a pediatric cuff, and I put on this young man, what's your name? Len. If I put the smaller cuff on Len, it will raise his pressure, not because he didn't like me as a doctor, but the cuff was small. So having the right size cuff is critical. So garbage in, garbage out. If you're getting wrong information and you're getting blood pressure medication and you're passing out, you'll break your hip because they didn't take it, either took it on your wrist or they took it with a pediatric cuff. The other important piece is when you're getting your blood pressure checked in the offices, make sure you're relaxed.
Yeah.
So, you come with fighting the traffic as Lynn was, getting cut off by a guy, and she didn't get a parking next to my office and she has to park 20 blocks away. So they're all upset and doctor is half an hour late. don't get your pressure checked then.
No.
Just say, okay, give me 5 minutes, let me take some deep breaths, put your feet on the ground. Don't do it that way like these two ladies are doing with the one feet on top of other. That will raise your pressure. And be calm. I know it's hard sometimes, but be calm and it will be that more accurate number. Which among you have the blood pressure machine with batteries?
I got all of them, I got.
Okay, again, give it to the neighbors you don't like.
Exactly.
You need to have the blood pressure machine with the AC hookup. The reason is the batteries go down and you will leave it for,
Mine has both.
right, so just don't use the battery piece, just take the battery out and use it for something else, but use the AC adapter, always. Because you don't get the inflation all the way up, with the batteries. So that's another nugget you can take. And that's why I'm saying it's very complex. First of all, to get a good reading is complex. I had a patient, she always say, hey, I take my blood pressure home, and she was a nurse, and she was taking blood pressure accurately at home, and I asked her all those questions, is it big enough, is it, hooked up to the AC? She said, yes, yes, yes. And her pressures were 170 over 90 at home. She used to bring the diary. And in the office, they were like 140, 130, 120. So that was 10 years ago, before we know about this condition called masked hypertension. So it could be other way around too. Some people have white coat syndrome. Most of the time, they come to doctor's offices anxious and the pressure goes up. It could be other way around too, and that can lead to not diagnosing their high blood pressure. That means if they're accurately taking their blood pressure at home, they could be lower in the office. That's called masked hypertension. So it's very complex. It's a huge topic. We just covered the basics, but it's very important to go by your gut. If you know that you have strong family history of high blood pressure and your pressure is high at home, but in the doctor's office is low, just persist. We heard about masked hypertension, and you need treatment like any other hypertension. So with that, we're going to come to close and open the floor for questions. Let me turn on the lights. Sorry. Yes, sir.
I have several questions.
Oh boy, he does not even have high blood pressure. There's several questions.
I wore a Holter monitor overnight, and the doctor informed me that I had, did you know why your blood pressure goes up at night? And no, I'm usually not taking my blood pressure at night, and but substantially going up into the 170 over 110.
Okay.
And then during the day, after I've taken other medications, it would relax. That's one question about nighttime blood pressure and how do you address it. Secondly is, if you have atrial fibrillation, where the concern is a blood clot building up in your heart and then going to your brain, intuitively in my mind, it seems like higher blood pressure would be better than lower blood pressure. You have less chance of forming a clot and thereby make people with blood pressure around. And third question, how do I find a cardiologist that's knowledgeable about the medications? Because I've found that most, when you talk to them about the side effects, look at you with a blank look. Like, okay, so what? It's almost like, well, which would you rather, your blood pressure be down, or the fact that you can't walk because of the side effects of
So let's take one question at a time, and thank you for those good questions. The first question you had, if I heard you correctly, is that, the variation of blood pressure during day and night, and how to address the one at night because you're not checking it. So it's interesting that your pressure is high at night. So you have hypertension, there's no doubt about it. So, you didn't raise your hand, that's okay, but you have high blood pressure. Typically, the variation of the blood pressure is, your pressure is highest early morning, 2 hours before you go to get up. And as the day progresses, it can go up, it can go down, but typically it goes up. The midday is when it is the peak. And as the time goes by, as the evening comes, it goes down. That's the natural variation of the blood pressure. But the circadian rhythm get changed, the blood pressure rhythm get changed in patients who are on blood pressure medication. So, there's a common blood pressure medication called losartan. So she's taking it. I was in a conference about 5 years ago and I was shocked because that was one of my go-to drug for blood pressure control. It has a half-life in most of the patient for 12 to 18 hours. So if you take in the losartan in the morning, good intention, good drug, ACE receptor blocker, number one class to give the blood pressure medication from. So now that natural variation of the blood pressure is not as consequential. What we call physiological rhythm of the blood pressure is like a river, it goes up and down, high tide, low tide if you live on intercoastal. Same thing is blood pressure, it goes up and down, which is normal variation. But now if you're taking a medication, let's say the losartan in the morning, I know what you're taking, everyone has different way of metabolizing the medication. So the losartan by design is 12 to 18 hours. So if you took that, let's say, with breakfast,
Take half in the morning, half at night.
so that's fine. So if you take it with breakfast, you thought you got it covered, but at nighttime, if someone wake you up and check your pressure, it will be 150, 170. So there is effect of the medication. So whosoever did that did the right thing by breaking in half, giving half twice a day. So that may be something, and that addresses your third question.
Doing that.
Yeah, that addresses your third question, is to look at the kind of medications. Are they synergistic if you're using more than one? So yes, having a knowledge of pharmacology of the drugs and working with the patient, and I think you will have better luck with primary care on that. Because they have a little bit more, listening ear than the specialist. You can find a specialist with listening ear, you can ask your neighbors, ask your friend, ask your primary care, and they can guide you in the right direction, but it's just by design the primary cares have more a detective hat on their head. Specialist is, we gave you the top of the line drug, this is what the recommendations are, this is what you got, get the hell out of my office. And that's, how they're trained. It's just a training. So if you can find a primary care who is more tuned to pharmacology, more tuned to listening to your concerns, you'll have better luck. The other unutilized resource we don't use in this room is pharmacy. The pharmacists get super good training in looking at your drugs, drug-to-drug interaction, side effects, and in education. So if you develop a good relationship, give them some candies or whatever, once in a while, and smile at least, they will be the great resource for helping you. So it's a team. Every touch point is a team. I tell my patients, I don't know everything. I know a lot, but I don't know everything. Medicine is like an ocean. Every day we find out new things, like as you said about losartan. We didn't know about losartan having half-life that withers away. Now we know, and I tell all my nurse practitioners, make sure we give it twice a day. So having a team which listens and utilizing the ancillary aspects of the team, like pharmacists, or if you ever had hospitalization, talk to nurses in the hospital or the home health nurses coming at home, wealth of information. So tap those, and you will have, and coming back to your second question about AFib and whether we should use a higher pressure, answer is no. Yes, it does sound physiologically right in your mind, but you are hammering your blood vessels in the brain non-stop. So the blood clot from the heart is taken care of by, whatever you're taking, Coumadin or Eliquis or Xareltos of the world. That's not going to be a concern as long as you take them on time. And mind it, most of the patients of mine for AFib, for the blood thinners, have shifted from Coumadin to the Eliquis and Xareltos. Good options, you don't need to check the levels. But the problem is, they miss one dose, the risk of stroke come back. One dose, because they have 12 hours half-life. Xarelto has 24, but still you miss one dose, you're 24-hour open. coming in, at least you have 3-4 days of, buffer. So answer your second question is no, you got, but not too low. That's the other thing. We don't talk about low pressures in seniors, and that's a serious problem. As we age, the arteries become calcified. You don't want to be too tight in their control. 140, I'm happy. Don't shoot for 120 or 110, because they get up and they will fall because of the pressure not going to the brain. So the hip fractures are very common as the pressures drop with taking too many diuretics and different combination of medications. So if you're dizzy, talk to your doctor and cutting back on the medication. That's the other aspect of medicine, which is very difficult, is backing off on medication. So you got to be your own advocate on that.
Yep.
Any other questions? Yes, ma'am.
Okay, I would like to address anxiety, stress, and blood pressure. I never had high blood pressure ever. I had hip surgery a year tomorrow ago, and it's been bad. I have one leg that's longer. I can't seem to, I'm going to a back doctor. She's trying to, I have lifts in my shoes. It's just nonstop, and it's very stressful. So my family doctor basically was telling me that you're doing it to yourself. And to hear that just really bothered me, and it made me more stressed because they were telling me like I was doing this to myself. So I've tried to like really calm myself and watch videos about breathing, exercising, and stress management. I'm here just to try to learn anything. I do a lot of research, but with this hip thing, I think maybe this is what has caused most of mine, is that.
So that's a very good question. When you have chronic stress, your body is constantly in a fight mode. The adrenaline is up and you constantly saying, oh, my hip, why did I do the surgery? I should have let it go. And it's very hard. And then you may be taking Aleve, ibuprofens, but by the way, I didn't cover that. That can raise your pressures too if you take a lot of
Well, I
those.
don't take it.
But I'm just saying, you can take Tylenol, that's okay, but any of the NSAIDs like Aleve and ibuprofens can raise your pressure, so don't do it. So coming back, answer to your question, is a very difficult thing to manage mental health. The anxiety, stress, so you check your pressure when you're anxious, and then high, and then now you're more anxious because high. So it's become self-perpetuating. So what I tell those patients is 3 things. One, don't look back on your decisions. Live in the present. So that's the hard part. Why I say that? My mom had both knees replaced about 6 months, a year ago, and she is in her 80s. And I pushed her hard for 4 or 5 years, and she said no, till she, was having very difficult time ambulating. And a year later, she's still having a hard time, and she is cursing me for pushing her in the, getting the knees replaced. But, she has less pain now, but the muscles are not in good shape at the time of the knee replacement, sometime in hip replacements too. So, you gotta let go. Yes, maybe having a walk with a walker probably was a better strategy looking back, but you can't change the past. So that's the hardest part. You gotta let go. One minute you do that, you'll be okay. And then you're on the right track in seeking more information, but you have gotta be consistent. Spend 15-20 minutes on breathing and meditation. You do that consistently, you will see a change in your mind. You start living in the present.
Well, I don't have much of a choice at this point. I mean, I'm going to every doctor. I'm seeing the behavioral, I do a telehealth thing.
Okay.
I'm doing everything that I should do.
One last piece, I said 3 things. So, we talked about letting go and meditation and regular meditation and breathing exercise. It has been shown to lower your pressure. No doubt about that.
Then I tank.
I know, but just you gotta work with the medications in terms of, some people are very labile and it's very hard. But I'd rather you tank and then lower the medication than, you stop doing meditation and breathing. I'd rather you stay with meditation and breathing and give you less medications.
Yeah.
So that's 1. 2, diet. Stick with Mediterranean diet. That's the key. But keep doing it. You didn't get here overnight, so don't expect the results to be, like this. We are by nature, someone fix me right like this. There's no fix at this point, you gotta just be consistent. And the third thing is, go to a gym which offer water aerobics. You know, the water takes the hip out of the equation.
I go in our pool for 20 minutes every day.
So you gotta be patient, be focused on the process. In a year, you will be a changed person, you will be better. But you're in the right path, you gotta just be happy with your process. Don't worry about the results will come. Just stay focused on the process, right?
Thank
We
you.
have silver
Silver
sneakers.
sneakers, we have.
We just joined.
Oh, you
Did
just
you?
joined very
Good,
well.
good, good.
It is the best,
So you'll be there tomorrow?
Where do you go?
right?
Right here.
Oh, well, we didn't know about this. I'm
Yeah,
gonna
we
find.
have it here,
It is
Monday, Wednesday, and Friday.
Okay.
The gym?
Well,
Yeah,
I'll
it's
find
on
out.
his schedule.
Yeah.
See, we have
okay.
the,
Awesome.
it's right there, it's scheduled.
Okay, I'll
Take
be
a
going home with a
bath.
lot of knowledge. Thank you so
Oh,
much.
no problem. So yes, you guys are all informed. You can give a talk here. You don't need to listen to my talk. I do appreciate.
No, we appreciate you
I
coming.
appreciate your time and patience and listening to my silly jokes. Thank you.
Thank you.